Hello everyone, my name is Hafsa Asibudian Imtiaz, and in this video I will talk about the resume of the first week lecture of Cleft, and Palate. More than 4 million are born with birth defects worldwide every year. Craniofacial anomalies comprise large fractions of all human birth defects, less frequent than only congenital heart disorders and cleft foot. Cleft lip and palate is the most common craniofacial birth defect, with an estimated 250,000 affected babies born each year in this world. To reduce the global impact of birth defect, we can do the effective family planning and improving periconception maternal intake of micronutrients. There are wide ethnic variations, common syndrome associated with cleft lip and palate, such as van der Wood, Reicher-Collins, Down syndrome, craniofacial microsomia, and fetal alcohol. Non-syndromic cleft lip and palate is a complex trait with multifactorial etiology resulting from gen and gen environmental interaction. Environmental factors such as cigarette smoking, maternal exposure to alcohol, maternal diabetes, and obesity. Failure or error in any cellular process that lead fusions of the medial nasal process with the lateral nasal and maxillary process can cause orofacial clefts. Orofacial clefts immediately recognize disruptions of normal facial structures. Occur when the embryological fusions of the lip, alveolus, and/or palate is disrupted during the first trimester of pregnancy. Multiple factors contribute to the occurrence of this congenital anomaly are genetic predisposition, environmental factors, drugs, and the interactions between environment and gen. Folic acid is necessary for the production and maintenance of new cells during periods of rapid cell division and growth, such as pregnancy. A cleft lip is a fissure, opening or gap in the lips, commonly the upper lips and/or palate, and results from the non-fusions or breakdown of the body's natural structures that form before birth. And then the anatomy of cleft lip and palate. First, there are lips. Lips are a pair structures present anteriorly on the face with nerve supply. There are also the primary palate and secondary palate. Theories of cleft development. There are failure of fusions of the components and failure of mesenchymal infiltration. Genetic in cleft. Genetic in general are hereditary elements containing biological information transmitted from parents. Genetic code is the language in the DNA that carries the instructions required for making protein products. Strategies for disease gen identification are linkage, genome-wide association studies, and exome sequencing. Cleft is caused by multifactorial. There are genetic and environmental factors. Etiology of orofacial cleft disorders. There are environments such as steroid, retinoic acid, alcohol, cigarette smoking, and folate deficiency. And there are 300 genes such as IRF6, MTHFR, and MSX1. That is all for me. Thank you so much for your attention. I would like to apologize if there is a mistake. I hope you have a nice day.